This is a case study of a client who has scoliosis and low back pain. And this is her gait when we started working together. This is how she walked. And I want to show you what's changed in the amount of time since December until now. She's worked really hard on her exercises and her homework. And so I'm going to play this video. This video here is the before video, and this is the after video. So notice that as she's walking in the before video, that she's wobbling side to side, and she's kind of leaning back a little bit more than she is in the video on the after video. So as she walks, also notice that as she's walking, she's leaning onto more of the left side of her body. She's shifting her weight more onto that left side of the body. She's still doing that to some degree in the after video, and this is because of her scoliosis. She has pretty considerable scoliosis and a rib dysfunction in that right side that really lifts up that shoulder and kind of pushes her over to that side to some degree. But the spine doesn't really start changing until the legs start shifting. So she's really starting to get a lot more freedom in her low back pain, which has decreased dramatically since we've been working together. But now that her legs are really starting to shift, and that's why I wanted to show you this video, she's getting more freedom from that, and she's not getting as much strain in her body as she was before. So notice how much valgus stress she has, or knock-knee stress she has in the before video compared to the after video. You can notice that when she's walking, she really kind of has to shift to the side because, one, she's not able to really tilt her pelvis properly, and her rotation of her pelvis is really compromised in the before video because you really need rotational movement in the pelvis to be able to attain proper gait. And you also need that rotational movement to be able to gain proper spinal alignment. I'm going to stop it right there. And we can see here as she takes a step, that step forward there, when she steps onto that left foot, she steps and how she really shifts, and look at that stress in the knee. Now when we look at the side from the back of the after, look how she steps onto that left leg right there. Much different in how she's aligned herself and how much more straightforward she's going, because now she has better relationships of glutes, better relationships with hamstrings. Her adductors were super, super tight, as you can see with that knee valgus stress. She's mostly using her adductors to actually walk forward rather than hip flexors and glutes and lateral stabilizers to really help her rotate the pelvis and drive forward with proper walking. And so with this muscle memory pattern and muscle coordination shift in her body with corrective exercises, she's able to walk more straight and have less compression in her back because of these muscles working more properly now. It's something that is really, really important, in my opinion, to attain when rehabbing someone's spine. You have to start with their legs first so that the spine can stack up on top of that alignment of the legs and the pelvis that are functioning more properly. Without that, it's really, really difficult to get any type of spinal shifts and changes in the body that are lasting and can really help that person decrease pain. Let me know your questions and comments. Thanks.